I've been involved in triathlon, Ironman competitions, marathons for the last 35 years. Even with doing that, people would remark at me, man, what's wrong with you? What's wrong with your back? It's the way you're standing, the way you're walking like you're a 100-year-old man. So after years and years of getting cortisone injections, getting chiropractor, getting everything else, finally going to Dr. Vaziri, and he looked at me, he says, man, you got a problem back here.
So when I sat down and looked at Bill's x-rays and MRI with him, he really had three things going on. He had lumbar stenosis, which resulted in what we call claudication, which is when you walk, your legs feel heavy and numb and tired, or your back hurts when you walk, and you have to sit down and it goes away. He had severe back pain from mechanical instability, and he had what we call spondylolisthesis, which is a really fancy word for his spine was out of alignment. And so the surgical procedure that Bill had was called an anterior lumbar interbody fusion. So it's a procedure that you do with a vascular surgeon. They make an incision in the abdomen, and we go down to the front of the spine with that incision, and it's a muscle sparing approach. And so recovery is actually quite good and quite quick.
Months later, I can do anything I want to do. I decided after the surgery I wanted to start doing bike packing. And I had decided I wanted to do the ride across America from San Diego, California to St. Augustine, Florida. And I'm looking forward to doing that pain-free. The thought of doing that before my surgery was not even possible.
Seeing Bill go from somebody who was really debilitated to somebody who is back to the level of activity he was 3 years ago. He's cycling across country, he's extremely active. It's what we live for.
My biggest thing about this whole process is the reaction from my friends and my family. We haven't seen you stand up straight in 20 years. We haven't seen you walk normally in 20 years. And to be able to go out and do whatever the heck I want to do and feel great about it, I mean, I know there's going to be a time, there's going to be a day I'm not going to be able to do this, okay? Today is not that day.